thanks to all the panelists. I hope that this really sends the message home that medical uses of cannabis are here. They're here to stay. They've been here since 2737 BC when Emperor Shenang put medical cannabis into his pharmacopoeia. All we need is the funding and the participants in order to make sure we've really got the proof here. By all means, you get the chance to tell a friend, tell your representatives in Congress, and let's tell our new president. So let's at least pretend like we have time for questions.
15 to 20 minutes.
You're the man.
Hey, Dr. Fry.
It's got to be a question though, Dr. Fry.
I solved Dr. Abrams' problem because when I was in practice in the early 90s, the orthopedic surgeons and the neurosurgeons who had failed back operations came to me and said, Steve, can you help me? We get tired of just seeing people and writing prescriptions for Vicodin and OxyContin, etc. I said, sure, send them over. And out of desperation, medical marijuana was legal. I started to use it. And first of all, that's your source of patients, is neurosurgeons and orthopedic surgeons have stables of chronic pain patients that are looking for any relief. The good part about it was 2/3 to 3/4 of these patients got moderate to significant improvement, and many were able to actually reduce their dosages of Vicodin and OxyContin. Consequently, when I talk on the radio and stuff, marijuana is not a gateway drug, it's a step-down drug. We have hundreds of thousands, if not millions, of addicted people that when they're allowed to use marijuana get by with sub-addicted doses of drugs. I want to thank Alan Cynthia. I got to take 1 minute here. This man has been unbelievably supportive of me since the minute I walked into his office 3.5 years ago. And the fact that there is a movement to get the Netherlands nominated for a Nobel Prize is as a result of his hard work, and I thank you very much, Alan.
My dad has a disease called familial spastic paraparesis, and he lives in Minnesota. And I was just wondering, how do you enroll people in states where medical marijuana is not okay? And how do you reach out to people in states where there's a real restriction on the use?
That's probably more of a legal question. I get a lot of emails from my website of people that have ALS and actually what that disease is. Fortunately, it will not take his life. That's actually a hereditary disease most of the time, but it can be extremely disabling, and I actually do think cannabinoids would be useful for him. I'm going to turn this over to maybe some of the attorneys out there. If you're in a state where there's no law, I think you have to move to a state where there's a law.
Question about itching caused by liver and kidney failure. Cannabis seems to work for that. Right? Question. And if so, how? How does that work?
I've never heard that it is a stopper. Well, itch and pain, I think, are carried on the same nerves. I'm not a neurobiologist, but itch and pain are the same nerve ending. So, since cannabis does seem to have an impact on peripheral nerves, that might be how that works. I wasn't aware that it works for. If there are two different mechanisms of the itch, I think liver failure is bile salt, and kidney failure is uremia, and it's a different itch mechanism, but I think it's all relates probably to damage to small nerves. Marsha wants the microphone.
It just seems like also the edibles seem to be more effective than smoke.
Edibles more effective than smoke. Actually, I'd like to ask a question about Alzheimer's. You mentioned ALS. I think more and more we're hearing that cannabis is better for Alzheimer's than any of the prescription drugs that are out there. And I know my mother-in-law in North Carolina is now doing brownies.
It absolutely is. Cannabinoids are the only compound that have been shown to inhibit the formation of plaque. So all the FDA-approved drugs, Aricept, diazepam, all of those are primarily anticholinesterase inhibitors, so I don't want to get into that, but the cannabinoids are the only thing that have been shown to inhibit the plaque formation in Alzheimer's.
By the way, in Massachusetts in 1991, in one of the memorializations, these 36 laws that were passed in the 80s and early 90s to get medical marijuana, which never effectively happened. In Massachusetts, they tried to pass laws, if I'm not incorrect, it was the Joe Hutchinson Act. And this man was a decorated Navy veteran who would literally have to take so much opioids to stop him itching through all his epidermal layers. Cannabis was the only thing that stopped him from literally itching his skin off. Your points well taken, Marshall.
The teachers helped me quite a bit. Dr. Claudia Jensen was working, who just passed away recently, was working with USC Tech School in a integrating cannabis and medicine program. I'm not sure what happened to that program. Are there any efforts to continue this or set up these type of education programs with teaching hospitals? That it's really necessary. I think it's really needed. But is anybody else continuing on that type of work?
I lectured at that program that Claudia sponsored, and it was very well received and nicely done. And so it would be great to have more and more of those. I tried to pitch this to some folks at Albany Med where I am now, and I apparently haven't met the correct people. So it's clearly going to take some time, but it's something I'm certainly committed to.
Two questions. One, when, if ever, is cannabis medicine contraindicated? And two, in clinical practice, as far as the standard of care, how much follow-up care do you think a cannabis physician needs to provide to the patient to keep it safe and effective?
If you get high and you don't like it, you shouldn't do it.
I have some really elderly patients who, sometimes I'm concerned about because of the possibility of rapid heart or blood pressure drops, that might not be good. People who have a history of stroke. People, psychosis I don't think is, I think many people with schizophrenia are self-medicating with cannabis because they find that it helps their thoughts. It's not that cannabis causes schizophrenia, that it treats it, actually. So I don't have that as a contraindication, but mainly cardiac disease. Then there's also the issue of should people with my patients with lung cancer, should they be smoking a substance? So I think that depending on what stage of lung cancer and where they are in their lives, vaporization is probably better, or eating. Eating does have that other factor that when the delta-9 goes through the liver, it becomes a psychoactive metabolite. So contrary a little bit to what Carl's experience was, when I had my patients in the hospital for 21 days, I really knew who was taking dronabinol and who was taking placebo, because people on active dronabinol, and we had to use a much lower dose, were very sedated and spent a lot of time in bed, whereas the actual marijuana smokers were much more active and moving around a lot. Also, I have a question for Carl, too, that we measured caloric intake over the course of 21 days and found that it went up for 12 and then it decreased in the cannabis smokers. And that makes sense to me because you don't see a lot of obese people who smoke all the time, right?
Yeah. No, a few comments related to your question. Obviously, when you think about using any psychoactive drug, you want to take into account the person's use history, because the effects will vary as a result, and particularly the effects that you might be concerned about, like cognitive impairment. If somebody's been using for a longer period of time, you feel more comfortable pushing the dose. Whereas if folks are relatively novice, then you may start to see some of those psychoactive effects, like sedation that you're talking about in those patients. Now, in terms of what we saw in our lab, we conduct these studies on a short-term basis. So when you say 12 days, you start to see the food-enhancing effects attenuate. Makes sense to me. We don't look at it that long. But in terms of young people not being overweight when they smoke marijuana, I mean, they're young too, so they're active. So there are a number of reasons for that.
I know some slim older people who smoke.
Yeah, because they're probably more health conscious.
Covariant.